Welcome and thank you for joining us for this Facebook Live media conference. Our speakers today will be Mr. John Canosa, Director of Public Health in Clinton County, Sheriff Dave Favreau, Clinton County Sheriff, and Dr. Wado Ritsema, who is a CVPH President of Population Health and Information Services and an infectious disease physician. Each will provide a brief update, and then we will do our best to answer any questions that you may have. Mr. Eric Day, our Clinton County Office of Emergency Services Director, is on hand as well to help with questions if needed. Since we anticipate duplicate questions on the same topic, please listen carefully, as the information you are seeking may be part of any of the speakers' prepared remarks or may be in combination with other questions at the end of this presentation. At this point, I invite Sheriff Favreau to the podium. I'm sorry, Mr. Canosa.
Thank you, Karen. Good morning, everyone. Good morning, Clinton County. As you may know, I'm John Canosa. I serve Clinton County as the Director of Public Health here at the Clinton County Health Department. As I often do, I will start with numbers for today. Numbers looking very good. We're doing very well. At this point today, we have 98 lab-confirmed positive cases. Of those 98, 77 are lab-confirmed positive cases recovered. We have 61 probable cases, and of those 61, 59 are recovered. Total tested to date, we're doing great in testing, 1,936. We're accordingly working on 19 active cases currently that are in isolation right now. Our partners at CVPH and other local medical providers continue to provide very good testing numbers each day. And now that additional test kits have been secured by the county, CVPH, and our medical providers from the state of New York. Our health department contact tracers continue to work very diligently, communicating with all positive and probable cases to identify their recent direct contacts needing isolation and quarantine. Accordingly, as part of their work, after this, they also follow up with these individuals throughout their isolation and quarantine period. As most of you know, the North Country region, 7 counties, including Clinton County, attained all of our state required metrics on this past Friday, May 15th, and then subsequently started Phase 1 reopening. In general, this Phase 1 reopening includes construction, manufacturing, wholesale supply, and retail businesses with curbside pickup. A number of our large manufacturing facilities have just started their reopenings after first instituting additional safety precautions and upgrades. Also, construction projects have started and or restarted in Clinton County. Although we are on our way with our Phase 1 reopening, it will take all of us working together to keep moving through the 4 phases of reopening. As is typical this time of year when schools close out their spring semesters, a few parties occurred a couple weeks ago. As a result of these large gatherings with little or no social distancing, in just a few days, a total of 11 students were identified as either positive or probable cases. If these 11 cases had required hospitalization, our hospital system would have suddenly become significantly burdened. This is the case in point that requires me to implore our public, young, middle-aged, seniors, that we all must maintain continued vigilance and self-discipline. Very important words. We must not become complacent. Like many of you, I dearly miss going out to a local restaurant in the evening time, or maybe visiting a pub, and forget about the fact that I really need a haircut. The important request here is that we all must stick to the plan. We have a plan right now, and that plan is to move slowly, cautiously, safely toward a full reopening of our region. We must continue to employ the protective measures we have learned over the last few months. Don't forget that. Distancing, using face coverings, effective hand washing. Our Clinton County Reopening Committee met again yesterday to discuss municipal, educational, and business sector progress reports, as well as plans for continued phased reopening. of significant importance, I must say a big thanks to the North Country Chamber of Commerce as they continue to work hard with our local businesses to provide safety and reopening training to many of our businesses, employers, and their workers in our region. Our public schools, Clinton Community College, SUNY Plattsburgh, they have already started strategizing and planning necessary safety provisions needed in preparation for the fall 2020 semester. In addition to the business training being provided by the Chamber of Commerce, staff from our Health Department, Environmental Health and Safety Division, and the town of Plattsburgh provided a Zoom safety and reopening seminar for our local town and village offices. This presentation is being continually updated with new information provided daily from the state of New York. Any municipality or business that needs this information, the PowerPoints or the Zoom recording, can contact our Environmental Health and Safety Division offices at 565-4870. Similarly, our environmental health and safety staff have also been working with our various county departments to provide safety upgrade recommendations, social distancing, public signage reminders, especially for our departments with high traffic public areas. At this time, it is expected and hoped that Clinton County and other municipal offices will be reopening as part of Phase 2 reopening. However, please know the start of the Phase 2 reopening will be determined and approved by New York State first. Not to mention the specific details for each phase opening are still pending. We're learning more as we go. There is no template for the best safe way to open. Decisions are being made based on the best information available at that time. Simply, we've never been through anything like this before in our lifetimes. This is all new, and we are learning something new every day. Although Clinton County and the North Country region is currently working our way through Phase 1 reopening, please be reminded that Governor Cuomo's New York Pause executive order relating to postponing or canceling all non-essential gatherings such as parties, celebrations, games, meetings, or social events remains in effect. We all must keep up with social distancing, at least until May 28th. On this subject, I must repeat my sincere request to all of you in Clinton County that we continue to employ and continue to practice social distancing, avoid crowds, wear a mask when in public, keep washing those hands. We are getting there, everyone. Thinking positively, back in March, when this was all just starting, who would have thought we'd be in Phase 1 reopening by the third week of May, as we are now? We really have worked hard getting to this point. Please remember that. Thank you all. Oh, I do have a correction here. We now have 14 cases associated with the parties mentioned over the weekend. 14, not 11, 14. Thank you very much, Ms. Karen. Appreciate it. I will now introduce Sheriff Favreau, who will come to the podium to speak with you.
Good morning and thank you. I would be remiss if, on behalf of all of the residents of Clinton County, we didn't take a moment to thank John Canosa and his team at the Health Department for their wonderful efforts, as well as Dr. Rietzma and his team up at CVPH. We're very fortunate here in the North Country to have the caliber of individuals that we do and to have the community response that we typically do. When the going gets tough, we stand up and we really get into it. Today is another floor for that. We need to really get people involved in this. If you look at the national news and you look at the statistics that are being passed around, our region, our county is doing very, very well. With the weather getting nice and the temptations, we don't want to fall into that temptation and giving it all up now. The last thing any of us want to do is start over again. That would be the tragedy of all of this. We've come a great deal, made an awful lot of progress with this, but we need to continue our efforts. It's very easy with the nice weather, high school graduations, as well as college graduations and many other events that we want to get outside and we want to celebrate. And that's understanding. That's the nature of what we do. We honor the hard work and dedication that people have put forward. But just as much as a high school graduation, the importance of that, or the importance of a college graduation, or even the upcoming Memorial Day, where we typically celebrate in good fashion, we also want to honor the hard work and dedication of our first responders, the people that have worked tireless hours, that have done the contact tracing, that have done the care of many ill people that have been hospitalized as a result of COVID-19. So we owe it to all of those people. Most importantly, we owe it to ourselves to continue the vigilance, to continue respecting fellow citizens. That's what this is about. I've been approached by so many people, especially when I'm in uniform. Sheriff, am I going to get arrested if I don't wear my mask? I turn to them and say, you know what? It's not an issue of getting arrested. It's not an issue of right or wrong. It's an issue of common decency and respect. If you're not a selfish person, you'll wear your mask. If you're a respectful person, you'll wear your mask. Those that do wear their mask consistently in public see the people that walk into a store, that walk into a crowd of other people, and they look at the one person without the mask, and you can just read their minds, what's going through their mind. How difficult is it to take a simple cloth mask and just wear it to protect other people? True, the mask may not, in fact, be saving you from becoming ill from COVID-19, but if you happen to be somebody who has it and you're asymptomatic and you're not showing signs of being ill, you could be passing it on to somebody else. Therefore, all the hard work that every single one of us, you cannot mention a person in Clinton County at any age, from 2-year-olds right on up to our extreme senior citizens, that have not been impacted by COVID-19. Stop and think about history. How many catastrophic events can we sit here today and say have directly impacted all of us? Not some of us, not age groups, not particular races of people, not particular genders of people. This has impacted all of us. Therefore, all of us need to stand up to the challenge and also implore your friends and colleagues that are with you, if they're not donning a mask to go into a store, ask them why not. Have them provide a mask, assist them in providing a mask. They're everywhere. They're in most businesses that you go in, most convenience stores, most emergency service responders have masks. So to say I don't have one is getting to be a pretty poor excuse. I do want to mention out there, with the nice weather coming and with high school graduations coming, I heard something last night that was pretty alarming. And I want to share it with all of the viewers because I think it's important to understand. Somebody came to me and said that they heard something that upset them. What they heard was an adult, supposedly a responsible person, telling a child, if you end up getting sick and they start to ask questions, don't tell them the truth who you've been with, because all of your friends now are going to get stuck being quarantined for 2 weeks with beautiful weather upcoming. That's deplorable. That's pretty pathetic of a human being to take that approach. That's selfish, that's disrespectful, and not caring for all the hard work that every single one of us, all of us, have put forth by maintaining social distancing, by wearing the mask when we're closer than 6 feet to other people, by washing our hands, by disinfecting our areas. Now you're going to encourage somebody not to be honest and truthful when other people could be contaminated and it could cost somebody their life. That's an issue, folks, that if in law enforcement we can clearly be able to establish and prove, we will look into any possible criminal charges that may be linked to that, because I think that's an intentional, willful desire to want to make things worse, not make things better. So please, people, encourage all your friends, all ages, all of your family, your neighbors, maintain the social distancing. When it's not possible, maintain the face covering. Wash your hands well, disinfect whenever possible, whenever necessary, but most importantly, the basic underlying message with this, be respectful for your fellow residents and for members in your community. If we can just wear this mask and we can maintain whatever level of social distancing we can effectively, quarantine the virus instead of having the virus quarantine us. And that's what it's going to take. We said on day one when we did our first press conference that this is an invisible monster that will attack anybody and doesn't care what it leaves in its wake. We can beat it, but we're only going to beat it together. We're going to beat it working as a team, as we have so far, showing the rest of the country we can do this. Clinton County is a leader. Let's continue to be a leader. I want you to be on my team, and I want you to follow all the safety precautions that the doctors, that the health director, that everybody have been preaching for months now, so that we can get through this, get on to phase 2, phase 3, and get back with our lives the way it was prior to COVID-19. I want to thank everybody for their cooperation so far, because obviously it has been successful. The work is not over. We need to continue our efforts. And I also want to take this opportunity to wish every single individual within our community, within our reach, a very happy, healthy, and safe Memorial Day weekend. It is nice out. It doesn't mean that we can't enjoy the nice weather. We just have to get a little bit more creative to do it, and we always have to have in our minds the safety and the respect of other people within our community. Thank you. I'd like to take this opportunity to introduce our next speaker, Dr. Rietzma.
Good morning and thank you. Just needed to find my notes. Thank you, Sheriff, and thank you, John Canosa. I just want to reiterate the great work that both your teams have done during this. It's been a wonderful partnership of CVPH with the county, and we plan to continue it. First of all, from a standpoint of CVPH, we are, fully engaged in starting to ramp up our services. In some areas that's going extremely well. In other areas, because it's more complicated, it's taking longer, but we're getting there. So I heard this morning that our outpatient offices, our doctor's offices, are actually operating at 84% of their pre-COVID levels. That's pretty amazing. About half of that is still through telephone or televideo. Those numbers may be a little bit different office by office, but we are ramping up. We're also ramping up elective procedures. It's a lot more complicated to do. We have to have people tested before the procedures. They have to be tested in the few days before their procedures, and we have to have a negative test before we proceed with an elective procedure. And just a comment there, we have experienced some people who say, I don't want to get tested. And just to be clear, if your procedure is not emergent, if you don't want to be tested, then we will not be providing the procedure. That's our opinion of the right thing to do to protect our staff, but it's also part of the Department of Health policy that patients, if they have an elective procedure and don't wish to get tested for COVID, then they will not have their elective procedure performed. So just to be clear on that. Otherwise, we're gradually opening up. We are looking forward to reopening over the next week or two our lab testing facility up near Hannaford's. And we're just, as the volume builds, we will open to what we need. Obviously, we're working out the kinks of how to keep people separate during that process, whether it's in the offices, whether they come in for surgery, or whether they come in for diagnostics. So our experience has been is that the public using our services has been great. We have not had issues. People are wearing their masks. People are abiding by social distancing. And I just ask people to bear with us. These are all new workflows and all new procedures, and we're doing our best. And your feedback about what works and doesn't work is helpful too. So just thanks for that. I want to, the sheriff was a great lead-in, because I want to talk a little bit about testing and masking. So we have gone, as everybody knows, from 0 to 100 in testing. I think back to standing here about 6 weeks ago when we reinforced to people that we did not have a lot of testing, but that it wasn't actually that necessary. And it's true. At that moment in time, for us in the hospital, we could function without testing. But we also talked about the fact that as we reopen, we're going to need testing to make sure that we don't backslide, that we detect things as they pop up. And so we've, partly in response to an economic drive to open our community, partly pent-up demand, and partly God knows what else, we're testing like crazy. And we're actually testing at rates that are stressing our resources. There's a requirement that nursing homes and adult homes test all of their staff twice a week for 3 weeks. There is not the financial or actually human capacity to accomplish that, and we're trying to. We can do it at CVPH, but I will tell you, many organizations in this community cannot. So we are testing at the limits of our capacity, and we're not, the testing we're doing outside of targeted testing, like someone who was at a party gets sick and now we test everybody else. Outside of that, we're not finding much. That's the good news. We're not finding much. But what that also tells us is that just wildly testing everybody is not cost effective. And we need to start thinking about much more targeted strategies. And we will be doing that regionally and working with the health department to think about that. We're learning a lot from this huge volume we're doing now, and what we're learning is that for the most part, we're not finding much outside of specific events like parties. So do we need to use all those resources to not find much, or do we need to target our resources where we think we're going to find it? And we're thinking more about that. The other thing I want to say about testing is testing represents a failure. When we test and find a case, we have uncovered a failure. We have uncovered a failure of an individual or a group of individuals to do what we know works, and that's social distancing and masking. It's finding failures on the back end, and it's not prevention. And everybody talks about we got to get a vaccine, that's prevention. Well, this, and just to reassure people, I'm at least 15 feet away from the next person, this is how we prevent. When folks first started talking about universal masking back in early March, I think there was skepticism. There was skepticism in the medical community. There was skepticism all over. But we're starting to see data that explains why masking works. What we know is that masking probably blocks somewhere in the neighborhood of 60 to 80% of what comes out of my mouth. You go, well, that's not very good. Why not 100? Well, 60 to 80% is pretty good. And let me explain why. We know that in general, people that get COVID, on average, infect 2.2 people. We know that. In select situations like a party, that number could be much higher. Those are special, super spreading events. But on average, a person that gets COVID without any other intervention infects 2.2 people. If I can reduce the amount of stuff coming out of that person's mouth by 80%, I can reduce that 2.2 down to whatever 80% of that is. I don't know, probably about 0.4. Maybe my math is a little off, but about 0.4. Well, we know that if we can get that number below 1, we can wipe out this epidemic. Think about it. If there are 100 people that are infected and each one of them only infects 90 people, and each one of them, the next time around, only infects 80 people, as long as it's less than 1 per person, we can do it. That's why vaccines work. So masking is probably the most effective thing we can do. And now there is some really interesting work out of some really smart scientists across the world, focused in the UK, that has done modeling based on what we know about masking. And it turns out that masking combined with social distancing is the most effective. It's more effective than lockdown. So if we all want to be out of lockdown, if we do those things, we'll be more effective. It's way more effective than social distancing alone. Why? Because we can't maintain it. It's really hard to maintain 6 feet. So this is probably the most important thing we can do. And this isn't testing which detects failures, this is prevention. And then testing can be used where we know that people are at greater risk for whatever reason. So I think that everything that we can do as businesses, as individuals, as local governments, to reinforce, however that looks, to reinforce masking is the most critical. When you look at the countries that have successfully managed this epidemic, many of them have done it without lockdowns. How have they done it? Many of them are Asian. In Asian countries, it is socially totally acceptable to wear a mask. So they've gone to universal masking. And universal masking without lockdowns, without shutdowns of economies, has been effective. And the models would say it's likely to be far more effective. It will be way more effective than social distancing alone. Social distancing alone will keep it down to a low level, but it does not have the possibility of truly eradicating. 80% masking in these models probably gets there with pop-ups here and there. So if there's one thing you walk away from, masking actually does work. It's not 100%, but it prevents a significant portion of what comes out of my mouth from getting at anybody else. And that's all I need, a significant portion. So if I'm infected, if I infect less than one person, that's fewer people over time. So masking, masking, masking. It's very important. Thank you.
Okay, great. Thank you very much. We have some questions that we've received both by email and on social media. So the first question is, when will surgeries that require overnight hospital stays be resumed, such as joint replacements? I understand day procedures like colonoscopies and mammograms are allowed now. Thank you.
So I don't actually have the answer on that. This is one of those where we're following the guidance from the governor's office and the Department of Health. And like all things reopening, you do one thing at a time, you learn from that, and then you move to the next. I think we're learning a lot as we start testing people for outpatient procedures. What we're learning is we're not finding much disease. So that, for our region, would be pretty reassuring to start doing inpatient procedures. But it's not within our control. And at some point in the near future, I would expect that Cuomo will announce that that is possible. It might not be statewide. It might actually be regional as he's approaching reopening. That would be the wise thing to do. What our experience up here is not New York's experience. In New York, it has to be on a different plan. So, New York City, I mean.
Thank you. Before you run away, I have just a couple more questions for you. I apologize. The next question was, with spring's arrival with lots of black flies and other insects that enjoy biting on humans, I'm curious if this nasty virus, COVID-19, can be transmitted by insects. The second part of the question was also, if an insect bites someone that's infected, then bites an uninfected person, is it possible for virus to be transmitted?
I have seen nothing that would indicate that this virus is transmitted by vectors, which means insects. The way an insect transmits a virus is it takes a blood meal, it sucks your blood, and then in biting the next person it transmitted. The mechanism, this is not a blood-borne infection. Hepatitis C, HIV, those are blood-borne, although mosquitoes don't play a role. This is a droplet infection. Gets back to why we mask. It has everything to do with the little droplets that come out of all of our mouths when we talk, worse when we cough or when we sneeze. That's how it's transmitted. And the black flies, as irritating as they are, shouldn't get blamed for COVID. So.
Thank you. The next question was, does Clinton County have the Abbott 15-minute testing available?
We do not.
Can anyone be tested yet, or do you have to have symptoms?
So If you go through your physician's office, there are guidelines from the DOH about who should be tested. The guidelines currently suggest that testing of asymptomatic, which people that are not sick, should be limited to essential workers. And based on what we're seeing, unless you have a known exposure, and that's it, that you would fall into those guidelines. If you go to your physician and say, hey, my cousin with whom I hung out was just tested positive, ideally the health department is going to be all over that anyway, but you would be indicated for a test. But what we're finding, so without getting too mathematical, right now, based on what we're finding in the region, if you don't have symptoms, your risk of being sick is probably less than 0.5%. Testing can make that, a negative test will drop that down to maybe 0.1%. There's not much benefit there. The test does not benefit you in many ways. If you're asymptomatic and you're following social distancing and you're masking, and you're not aware of an exposure, your likelihood of having this is well less than 0.5%. And I'm being very generous. Based on the numbers we're seeing, it's probably more like 0.2%. Very low. Is that it?
Thank you. One more question for you, and then I'll let you off the hook. There were a couple of different questions regarding the accuracy of antibody testing. There were some questions about if it's being done locally, what test is being used, and how accurate is the testing.
So there are some offices that are offering testing through national labs like LabCorp or Quest. We at CVPH are not offering that routinely. We have not been convinced, nor is our reference lab convinced that antibody testing is as good as it needs to be. The other thing that I have said before, antibody testing is probably, for most of us, of very little value. 99% of us haven't been sick. We haven't gotten this. So 99% of us up front are going to be negative anyway. And if we're positive, I would question that, because one of the problems with antibody testing is it might have false positives. And false positives might, if I get a positive result, I might be tempted not to wear a mask. I might be tempted not to follow social distancing. But if that positive result was inaccurate, I've just put myself in harm's way. So at this point in time, other than for studies, for New York State doing surveys, I do not see much value in our region of antibody testing at all. I could imagine some very specific situations where a conversation with a physician might come to the idea that maybe it is of value, but those would be very select situations.
Thank you very much. The next question we have is for Sheriff Favreau. The question was, if you see people partying or large gatherings, should you call police, and will there be any charges?
I certainly would encourage the general public, because they have a lot of stake in this game, I would encourage them to report any large gatherings, because it never hurts to have an authoritative position go and speak to whoever is having the gathering to make sure that they are putting some type of effort forward for social distancing and wearing of the masks, and they may be able to be of some assistance with that. Keeping in mind that sometimes parties get out of hand, especially when you get to the college level. They may start with 8 or 9 thinking they're in some type of compliance, and before they know it, there's 30 people there, 40 people there, 50 people there, and they may need some help with that. So I know in speaking with the Plattsburgh City Police Department and of course for the Sheriff's Department, we certainly will be looking for the help of the public, and certainly would appreciate the help of the public. And we'll start with being very cordial and very polite and trying to get people to comply with us, and whatever happens from there, we'll deal with it accordingly.
Okay, thank you. Another somewhat similar question, but a little bit different, also for you. The person stated a condition of entering stage 1 is curbside delivery and limited in-store shopping may occur, but in all cases cars must wear face masks when making pickups and stores must enforce the wearing of masks. And then the person goes on to state, it was stated by the governor that these rules must be enforced by local authorities. The guidelines are not being followed and guidelines are not being enforced at this time. Is there a plan for enforcement?
I think a large part of that is education on the part, as John Canosa talked about when he was up a few moments ago, working with the Chamber of Commerce. I think that the people who want phase one and phase two and the continued growth of our economy to be successful are the merchants. So again, they've got to have some skin in the game as well and attempt to enforce these initiatives. If they have problems with those initiatives and people become non-compliant and belligerent, I certainly would encourage them to contact law enforcement as well, but we will not be having mask police standing at each business door doing it. People need to keep something in mind, and John could speak better to it than I can, I'm sure, but it has always been a health regulation, to my knowledge, everywhere in New York State, that you have to wear shoes and a shirt when you go into a public place. How is this any different? If somebody walks into your store with no shoes on, hopefully you would do something about it. If somebody walks into a store with no shirt on, hopefully you would address it. It's the same thing with a mask. It can be addressed and it can be done politely and cordially. And if that becomes a problem, then you can offer to call the local authorities, and I'm sure law enforcement will be glad to show up and assist with that issue.
The next few questions we have are for Mr. Canosa. There are a few different reopening related questions. The biggest question on the public's mind, when will the DMV open?
That is a big question, and that is a place, a county office, where a lot of work has gone into adding additional safety features, barriers, tape on the floor. Again, as I mentioned, phase two is looking like the phase, which is our next phase, coming up in a couple weeks, a week maybe from this Friday at the earliest, when the DMV could open. So that's as much as we know right now. As I also mentioned, each of the phases, there's some detail, a little bit. But the big details that we need to specifically outline this store versus this county office or this town office and what they do, it won't be outlined till just before phase two is open. So we're playing this all by ear. We're learning as we go, but this is what is hoped for, and this is what is expected from myself as well as my peers and legislators in the county.
Thank you. So in regards to that, some of the other questions in regards to opening were, when will the library open? When will early intervention services resume in person?
These are some of the same answers, more or less. Phase two, professional services. That's what caught my eye. That also pertains to hairdressers, get a haircut type of thing. That's under phase two. I'm assuming, we're expecting. Don't know, early intervention, looks like phase two coming up. The library, can't say about that. It behooves all parties out there, educational, institutional, business sectors. North Country Chamber of Commerce can help you have a plan. Couple page plan, 2-3 page plan, have a plan. Start jotting down some notes of what you can do to make your business, your institution, your library better, safer. That's the goal. Have a plan. So I just can't say on libraries. So.
Okay, thank you. Are these determinations made at the local or the state level?
They're made at the state level. The state level makes that. It is our job, tough job, to interpret some of these decisions. So it can be tough. So.
One of the other frequent questions we've seen, how do yard sales fit into phase 1, 2, 3, etc.?
Wow, that's a rough question. Yard sales, first off, I'd say, can you hold off for a few months? That's my first knee-jerk statement on that. Can you hold off a while till we get into a better circumstance phase-wise, COVID-19 wise? If you're having a sale, I'm not saying I would approve it, but masking is definitely applicable, and social distancing. Social distancing always leads to charge on this as far as a safety precaution. but masking. I totally agree with Dr. Rietzema and all the recent articles I've read on what he is indicating to all of us, that masking seems to be the way that we need to be going as a community, as a state. So I would say that's my recommendation.
Okay. The next question, we received a couple of questions regarding graduations for June and July. One of the questions being, has the local health department received any additional guidance from the state in regard to graduation?
No, we have not. That's the answer. We have not received any more guidance. I am, however, making myself available to assist with Champlain Valley Educational Services and all the school districts under their purview. I've also received a couple of different general plans, if you will, for graduations. The old-fashioned graduation in the old days in Plattsburgh State's field house, not going to happen. That's just not going to happen. There's another model by the Air Force Academy where those cadets, well-disciplined cadets, stood on a football field. No family in the stands. That's probably not going to happen either, okay? Families want to be there. The most likely scenario that I'm hearing about and seeing is the car parade, where everybody stays in their car, that immediate family stays in their car, and the graduate gets out, picks up his diploma, parents take a picture, they all get back in the car, and they go home for a nice, easygoing family, immediate family party. No big parties, okay? We're going to keep that social distancing. Don't invite everybody up. I took the opportunity to go on a limb on this one, but yeah, we want to keep it minimal for now. There will be time for a party. Let's just postpone it a year, something like that. So, okay?
Thank you. The next question, with the recent spike in cases, is the health department reluctant to continue on the path of reopening?
No, I can say most importantly that the cases that occurred as a result of parties did not negatively impact the hospital. That is our most important criteria there. It didn't impact terribly their beds, their vents, but however, I must mention, we got lucky. We, the hospital, the health department, we got lucky. That's not always going to happen that way, okay? Just because you're young doesn't mean you can't get very sick. I know a few of the cases that we've had are very fit people, and they were in bed for 3 weeks in bad shape. It will not impact. What impacts it is we must keep up a criteria of the metrics for testing, have staff to do contact tracing, and specific criteria related to the hospital must be maintained as they're doing good. Okay, they can't have too many beds full. They can't have too many vents in use. Things of those nature. So not necessarily will those cases cause it, but indirectly, if we get it again, another party like that, it could definitely impact where we're going in phase 2 or set us back to the beginning again.
Thank you. When the DMV opens, will they decrease the amount of people allowed in line?
Most likely, if I have to make a statement, I would say yes. Capacity is one of the ways you control social distancing. I would say that's on the docket for consideration, yes. Yep. You're going to make, as a society, as a public, things to reduce waiting times everywhere. That's the goal. When in doubt, make a phone call first. You're not working too hard. Make a phone call, you know.
The next question, again in regards to reopening, is the Clinton County Fair still going on?
As I understand, the Clinton County Fair has voluntarily, of their own volition, even though I did talk to them, they have voluntarily indicated they would be closing or I should say canceling the 2020 Clinton County Fair. It was just made known to me, and I did read it in the Press Republican on my cell phone this morning.
Thank you. Another question in regards to what is the difference between individuals gathering in, what is the difference between the kids partying and Walmart being packed?
I've been to Walmart. I don't get out much, but I did go to Walmart. At Walmart, I did see people in masks. You catch the occasional one here and there, and I have noticed, as Sheriff Favreau had indicated, some people give them the dirty looks. Hey, it's warranted, you know. if you're going to be without a mask and you're not going to stand on top of me, you're going to keep that social distancing. The Walmart thing has some controls in place that I can tell you. The kids partying, clearly no controls in place. They were doing what they were doing, what I did 35 years ago. So yeah, but that was then. This is now. We are in a new age now.
Thank you. Another question, what phase would playgrounds opening be in?
That's probably one of your more difficult things. Playgrounds, I'm talking to the whole public now, must be considered one of your highest risk areas. It's a playground. Whether it's plastic, metal, wood, it still has the ability to harbor infectious diseases like COVID. Okay, I would strongly encourage all of our public right now to not use playgrounds. This may go down as the year where not many kids are using playgrounds, and that is a good thing. Simply because there's no one there cleaning it. There's no one there spraying a disinfectant on it or wipes on it. It's unless you have your own playground at home. I was thinking about this. That's okay. You can use it. You know that's your playground. But the municipal playgrounds, the school playgrounds, nope, don't use them. Don't.
And then I think you addressed this a little bit before, but the question was, will there be any specific regulations for hair salons in phase 2 due to the close proximity? There's another, I can just clearly say it's a definite that they will have to do probably the most upgrades of any other facility, similar to dentists, eyeglasses places, things like that, where you have that close worker to patron working relationship. They will have to employ the biggest safety provisions of all. Everybody's wearing a mask when you're getting your hair cut. Everybody's sanitizing everything. Gloves are going to be worn. I could probably go on 3 or 4 more times, but I've even seen some on the national news where there are barriers between the person cutting the hair around a barrier, and it's a plastic sheet just coming down. So it must be hard. Thank you very much. The last question for Dr. Rietzma, I believe we talked about this a little bit already, but somebody is asking, now that tests are more available, who should get tested?
Again, the guidance from the state is still obviously anybody with symptoms suggestive should be working with their physician's office to get tested. Currently the guidance is to test asymptomatic essential workers and other people, anybody who's asymptomatic but might have had an exposure, a documented exposure, we would test. That's how we know about 14 cases from a party. I would wager that many of them were either asymptomatic or minimally symptomatic. I am not in favor of just anybody getting a test right now. We're doing more testing way more testing than is necessary to meet the state guidelines. And we will, because we have these regulations about surgery and nursing home staff. So there's going to be no trouble meeting the level that we need to keep. I don't see value. Testing is not cheap, and somebody's paying for that. Maybe it's your insurance, maybe it's something, but basically, as I said, if you don't have symptoms and you live in Clinton County, in general, your risk of having COVID is about 0.2%. And if you test negative, now you know your risk is about 0.1%. At $125 a pop, that doesn't seem like a very valuable thing to do. Much more valuable is to invest $5 in masks and wear them.
Thank you to our speakers, and thank you for joining us today. Later on, we will have a closed caption version of this conference on YouTube, so please feel free to take a look at that if you need to review any of the questions and answers that were provided today. Thank you.